Michael Boyle's StrengthCoach.com presents the Strength Coach Podcast, brought to you by Perform Better, the experts in functional training and rehabilitation. PerformBetter.com.
All right. Hey, everybody. Welcome to episode 388 of the Strength Coach Podcast, brought to you by Perform Better, the experts in functional training and rehabilitation. I'm your host, Anthony Randa. The show notes are located at strengthcoachpodcast.com. All right, guys, on the strengthcoach.com and NBSC.TV Coaches Corner, spoke with Coach Boyle about where the sports hernia is gone. I kind of had a little bit of a minor self-inflicted hockey injury, like a kind of a groin pull type thing, minor. But kind of got me thinking about sports hernias, and we used to talk about them on the podcast a lot, and they kind of came up, and I wanted to kind of get his take on it. Takeaways from the Principles of Programming lecture at NBSC, which is actually on NBSC.TV now, and that was with Mike Perry and Eric DeGotti, so I want to talk about a little bit about that, and our role as strength coaches in athlete compliance. Where does that line get drawn? For the Hit the Gym with the Strength Coach segment, I have Amber Kivett, and she's not really a strength coach, but she is. She's an athletic trainer, a CSCS, a therapist. She's the owner of Kivett Kinetic Solutions in Indiana, and she has a really unique approach when working with clients by offering a fusion of sports medicine, human performance, massage and bodywork principles, life coaching, and her thing is she gets people out of pain really fast. So kind of spoke about her background and some traumatic events that led her down this path of discovery to get herself personally out of pain, which is really, it's a crazy story. And then ultimately helping thousands of others. And we're going to talk about something she talked about in her lecture at Perform Better, and it's about the fascia and really including its role in pain and what makes it angry, the 6 things that makes it really angry, and what you can do to help your clients right away. So we go really deep. It's a long interview. It's really good. I love what she's doing. So check that out in a little while. For the Naamly Maximizing the Member Experience with Sumit, founder of Naamly, Sumit's going to talk about dealing with challenges that life throws at you, which lately he's been dealing with some himself over the last few months, and how you can use the A.C.E method, he loves his acronyms, to get you through those challenging times. We're going to continue our special 4-part series, Testosterone Replacement Myths and Misconceptions, with Ali Gilbert, the queen of men's health and the founder of the Silverback Summit, which this year will be on November 15th and 16th in Phoenix. I'll be there. I'm gonna check it out. Spend a couple days there, kind of right up my alley. So looking forward to that. Guys, you can use the code ALLYG200 and get $200 off. Pretty generous of Allie. You can do all that at silverbacksummit.com. Today in part 2, she's going to talk about prostate cancer and its relationship with TRT and treatment, and kind of just going to clear up some myths about that. Today is the last day for the Perform Better big sale of the big summer sale. 40% off a bunch of products, over 100 products, rowers, air bikes, dumbbells, kettlebells, racks of all kinds, bands, so much more. So last day for that. Guys, remember too, PB has partnered with Josh Hankin once again for the Fascial Fitness 6-week online masterclass. Good timing with Amber coming on today as well. Guys, and you can just go to performbetter.com and there's a discount through that for that 6-week online masterclass. Josh and Jessica do an amazing job. All right, lots of things to get to, so let's get on the phone with Coach Boyle. All right, guys, now it's time for the StrengthCoach.com and NBC.TV Coaches Corner with Coach Boyle. Remember, you can try both sites out 7 days for free. StrengthCoach.com still has the same great forum as always. And NBSC TV is basically just, you're a fly on the wall at NBSC. They started the staff meetings again. If you follow us at all, you'll know that, when the fall comes, the staff meetings are back. So there's already last month, there was 3 staff meetings posted, and we're going to talk about an in-service in this episode, actually. So Coach, how you doing?
I'm doing well, Ian. How are you?
All right. So Mike, all right, I mentioned this a little bit in the interview with Amber, but So I'm kind of been skating again, and so everything's been great, right? I'm like re-energized. I'm like, this is the way I can get high, zone 5. I'm, going to my highest heart rate, and been monitoring it. And it's been great to do intervals. So kind of taking a page out of your book with the guys, maybe even far back as BU, or like, okay, doing some sprinting and then going over to the bench, wait until the heart rate goes down, just monitoring it, 40 beats, boom, back out there going again. So kind of utilizing some of the knowledge from here to kind of get back in shape for that. And so last week I took a shot towards the end, and like a snapshot, and it kind of got a little pull in my groin. So, I've been nursing it, got off the ice right away. I said, just was not, no, wasn't a big deal, but I just didn't want to sit there. In the past, I might have stretched it, made it worse. But what made me think of it was I've been doing some work on it this week. I have not heard like sports hernia in a long time, because we probably go back to the beginnings of this podcast, and we probably were talking about it, those type of things and those type of injuries. And I know you were in hockey more at the time, you still are, uh, but did it go away, or are we getting better at training, or where's the sports hernia or those type of injuries right now?
I would say we're getting better at training. I think one of the things that because I wrote some articles, it'd be interesting to go back and look and see when that whole kind of hip series was, but I'm going to say 2010, 11, so
Yeah.
almost 15 years ago was when this really started to kick up. And what was happening then was a lot of people were skating. They kept skating when they did what you did. So you did that, you kind of popped it a little bit and you thought, hey, I'm going to get off the ice. The way it used to be was you were supposed to stay on the ice because you didn't want to look like a you know what, right? So you stayed out there and you made it worse and you started to change your gait, you started to shorten your stride or whatever it was. And then suddenly that started to affect kind of your lumbopelvic mechanics. Suddenly now you're trying to figure out, wow, how do I create that recovery stride without being able to use that muscle that's sore? And I just think we've gotten smarter. I think people even we've gotten smarter groin work. Although I'm not a huge Copenhagen's fan, but we started to look more at specific adductor work. We're starting to look at, I think there's way more unilateral work being done. So there's just so many more things being done that probably are preventative. There's um, guys, the other thing that maybe is helping is guys start skating sooner. The guys don't go the whole summer without skating and then suddenly jump into training camp and get killed the first couple of weeks of training camp and develop all these groin overuse injuries that lead us to sports hernias. So I would say, to use an overused term, multifactorial. I think there's a lot of reasons why it's probably decreasing, but I would think us getting smarter, players themselves getting smarter, us doing more direct groin work and understanding the type of groin work that we need to do. All of that probably combined leads that to at least have dissipated.
Yeah, I think too, from just in my brain, was my response to that was, the next day back, right, kind of going in the gym, working on some strengthening for it, making sure like I took there's no double leg right now for me. I'm just it's got to be single leg, and then working on some, getting the ankle cuff and working on some different hip movements, right? Working on and thinking about. I always do multiplanar, but thinking about that, like more of the warm up, that kind of Gary Gray, Todd Wright stuff that I always do with my clients anyway, that I'm making sure I'm doing, kind of making sure I'm moving in all planes of motion through the lower body. Also, I think some of the things with the tension, or like almost like a FRC, or stick mobility, or a lot of people talking about like tension at the end range of motion. So not just doing stretching, kind of use some body vibration as well in there as well, just to kind of get some stretches while on the vibration plate. Just trying to think there's a lot more options for us as well, and a lot more. So from my perspective, kind of that approach that I took, I felt like, and I feel great. I skated Monday, might skate today. So I was back on the ice feeling fine. But I felt like, hey, I have to keep don't just rest it. Got to keep on add that stimulus, create that adaptation kind of slowly. rested, work. I had a little more recovery this week than maybe I normally would have too. Just thinking about that stuff, but I just thought it was interesting that I haven't really heard it in a while.
It's funny you say because you're right. We haven't heard nearly as much about it.
Mike, you guys had NBSC.TV posted the Mike Perry and Eric DeGotti came in, the principles of programming guys, and they did a lecture. And I know those are guys that were heavily influenced by you along the way. And I just wanted to see. Sometimes it's nice to. I'm sure it is for you, and you've talked about it in the past. Like when to kind of see people reinforced maybe in a different way, very heavily influenced by your stuff, but maybe just with a different approach. What was the takeaway this week or last week at Principles of Programming?
I think the big takeaway was that it's what they were talking about. The big takeaway for us or for me was that it's really similar to what we're already doing. So I think it was really reinforcing for our coaching staff. The coaching staff really liked it. And I think you're hearing it from a different voice, which I do think matters. I think sometimes I can become like dad, kind of wah wah wah, and I'm always the one talking. And when you bring somebody else in and they start talking a very similar language with very similar concepts, I think it reinforces for the staff that, hey, we do know what we're doing. Hey, we are doing things right. Hey, I I did when I wrote this program, I was kind of moving in the right direction. So I think it was a really good opportunity for us to reinforce our program design concepts for our staff.
Yeah, I think for gym owners too, it's a great lesson in you do a lot of in services, get people to come in, and to be clear, it's not always this way, like somebody who might have always agreed with you or mentees. It's people that you're hoping to grab a little bit of different, like a Tony Holler originally when in the beginning, right? Different concepts, different ideas, really probably the same but different. And it's good for coaches to kind of get your staff exposed to some of these other ideas, different approaches, like your favorite saying through a different lens.
Yep. I think it's it's interesting because you don't want to get too far off because then I think sometimes you can confuse your staff. So I think you need to bring in other voices that are going to be reinforcing, but not 100% reinforcing. I always talk about the idea. Tony Holler came in and said, "I don't care if my sprinters lift," and our whole staff was just freaked out. Everybody looked at me like I can't believe you let this guy talk. I can't believe he's here. And I had to kind of settle them all down the next week because we always, a lot of times, not always, but we'll try to process what we heard in the next meeting sometimes. And I explained why, hey, we're going to continue lifting. We're not, Tony's talking about his track kids who don't play football. And he said, I don't care if they don't go in the weight room and lift as long as they do the things that I want them to do. I said, we don't deal with track kids. We have very few. Honestly, I bet if we get a dozen track only kids a year, that might be a lot. It's probably less than that. I bet it might be less than 6 kids we get who just say, all I do is track. So
Yeah.
I think it's good to get them the exposure. And then it's good. I think the thing that we do well is we always process the information, particularly if there's things that I think are could be confusing or could be conflicting. And then we talk about, hey, here's why we're going to continue down the path that we're on, in spite of what this person might have said.
Yeah. Mike, on Twitter, Zach Evanesh had posted, you can be a great strength coach, but if your athletes are not compliant with consistency, effort, proper nutrition, lifestyle, then it means nothing. I don't think he was meant talking about whether or not that made you a great strength coach or a bad strength coach. But you had asked, but are you a good strength coach if your athletes aren't compliant? And my part of that is not that I have a problem with that type of a thing, but sometimes there's some like proper nutrition. There's only so much you can do with trying to make sure you have how many kids do you have? How many are you going to go out and make sure that they're having a breakfast or whatever, having enough protein? That's hard to do. I don't really believe 100% that's a reflection on like proper nutrition, lifestyle, effort. Okay, you can push people. Consistency, you can hold people accountable. The other stuff, it seems hard to kind of throw those things in there. Consistency and effort.
I
What are your
agree. I
thoughts on
guess
it?
the difference for me is I just thought it was a little bit of devil's advocate in terms of if you can't get your kids to buy in, then you're probably not a really good strength coach. I think that's the point I was trying to make. And I think his point was that you can be a really good strength coach, but kind of if you got bad kids, then
Means
there
nothing.
could be a problem. And my thing was, well, I guess I always use like the survey thing, right? Is it, if I always say if this was a survey, I'd click strongly disagree. If this was a survey for him, I might click somewhat agree. I
Yeah,
somewhat agree with you, but I do think that we get too many guys who think they're good strength coaches, but they have really shitty soft skills. So the kids aren't there. The kids aren't engaged. The kids aren't buying into what they want them to do, even though this person may have the kind of X and O knowledge necessary for somebody to make progress. So I guess I just was, I think, trying to tweak the conversation a little bit or maybe direct the conversation. And I do that sometimes on Twitter just to say, well, is it that simple? Because I think, and that was one of the things, and I wasn't referring to Zach at all when I said it, but I said really definitive opinions with limited experience is a problem. I said on Twitter the other day because you get these guys all the time. You get these young high school or college strength coaches who aren't even 30 yet, who are, you got to do this. And it's kind of like, you really have to be careful with your you got to do this and with your disagreeing with people when you really don't have a whole lot of miles under your belt. And so obviously that's not the case with Zach. He's been doing it for a long time, but I just I like to keep the conversation going. Maybe I'm stirring the pot
yeah.
a little bit.
Well, I think some of the
Probably.
answers were well, if your administration or your sport coaches aren't involved. And for me, I kind of somewhat disagreed with that was because I there's only so I have to control what I can control. People coming into my weight room, that's what I can control. I can, like we talked about, can I control consistency? Yeah, I can hold them accountable for that. Can I control the fact that if they're coming in late, can I try to push them on their effort? Yes. Can I give them education on proper nutrition and lifestyle? But I think when they start mentioning, sport coaches and admins, I don't really feel like that's, uh, now it depends on what they were talking about when they meant compliant.
Right. And like I said, I guess the difference I think is that it comes down to the culture creation part. Because again, I would say somewhat agree. I think I had times the best experiences I had in strength and conditioning at the college level were working with coaches who were really bought in. Because coaches that are bought in create athletes that are bought in general. But yet I had really great opportunities and relationships with our football guys. And we had a whole bunch of different coaches, some more bought in than others, some who thought it was more important than others. And yet we still were able to get guys engaged and in the weight room and making progress. So um, I just, I think it goes back sometimes to the idea it's really easy to make excuses about why you're not being successful. It's the same process of people saying, oh, it doesn't really matter. You're not affecting wins and losses. And I think, yeah, you are affecting wins and losses. If you're constantly working with teams and nobody wins, you might need to look at your programming. And I think that's part of the issue is that it's just easy to not be introspective. And I guess my thing is I want to encourage people to be introspective. I want to encourage people to look at their programming and at their results and at themselves and say, hey, am I really doing a good job? Am I looking in the mirror enough? Or am I going to blame the kids? I remember when we first started Mike Boyle Strength and Conditioning, there was a guy that was working there who had been an intern with me. And I remember coming in and thinking, wow, this technique's not great. I don't love the way a lot of this looks. And this kid, all he ever did all the time was make excuses. Well, this isn't BU. We don't have the kind of athletes that you have. And I was like, I don't think I want to operate this way. I don't think I want to operate from the standpoint of, oh, these kids are just average, so we're going to let them be average. I think you can take an average kid and have them be really technically above average in the weight room if you're a good coach. That may not necessarily have the greatest impact on their sport performance, but historically for me, it did. When I looked, kids did get better when they got better in the weight room. So, and teams got better, teams that were more compliant, teams that bought into what we talked about from a nutrition standpoint. And again, I always, same analogies all the time, right? Bell curve. Yeah, 20% of the people aren't going to give a shit. 27% of the people are going to be really tuned into what you want to do. 60% of the people are going to be somewhere between don't give a shit and really dialed in. And I always think like your job is to shift the curve. That's really what you're trying to do. You're not going to change everything, but I think you can shift the curve. And I always thought I programmed for that middle 60%. I programmed for the stuff that's inside that curve. Maybe the top 20% might get undertrained, might not get as much as they might need and or want, but they're not the ones that I'm worried about. And then a lot of times, honestly, at the college level, I was trying to get people to run off that bottom 20%. Hey, if we got kids who really don't give a shit, we got to get rid of those kids, particularly if they're not good, if they're not contributors. If you've got a kid that's down the bottom that way, but who's one of your best players, then you got to try to bring that kid up. I actually did a talk yesterday for one of our junior hockey teams. And I talked about, I know we've had this conversation, but I talked about Greg Carvel's culture talk up at UMass. And the idea of, he classifies kids as threes, twos, and ones. Threes are doing everything right. Threes are the guys that you want. Twos are twos. They're in the middle, right? They're not bad kids. They're doing kind of what you want. Ones are your shitheads. Ones are the guys that you probably want to run off, the guys that you want to replace as fast as you can. And the thing, he used the expression in his talk, my job is to squeeze the twos. And I love that idea. And I think that's what you're doing as a strength coach, right? You're squeezing the twos. You're squeezing that middle of the curve. Because if I said we had a group of, say, 30 kids yesterday. And I said, okay, if we've got 30 kids, 6 of you are threes, 6 of you are probably ones. 18 of you are probably twos. And what we're going to try to do here today is impact the 18 of you that are twos. And maybe we impact 6 of the ones and make them twos. Maybe some of those guys, if we kind of looked and said, what's my average on my team now? And we said, wow, I shifted my average up to, my average now is 2.7 or 2.8. Okay. We did all right. We made some progress. We've made some changes in the mindset of these kids. And if we can make changes in the mindset, then we're going to make changes in the physical capability, because mindset's getting them to think, okay, food matters, sleep matters. Excuse me, my effort in the room matters.
Yes.
And so if you can get that to happen, and I always felt like that's what I did really well at Boston University across a really big, diverse group of people. We had tennis kids who really bought into what we did. We had rowers that really bought into what we did. We had basketball players that really bought into what we did. We had field hockey players that really bought into what we did. We had some wrestlers who really bought into what we did. And the ones that did tended to be really successful. There was
Yeah,
a very direct correlation.
yeah, I think it's funny because on today's show, talking with Amber, and we're talking about pain and when people come in and she has a different approach. So there's really got to be this conversation about buy-in, about believing in that you can get rid of this pain. And I feel like it's a similar situation with like what you're saying is a mindset. Like if you get kids stronger, they're more confident, no matter what in life, just in general, right? They're going to be more confident. They're going to be more confident on the ice, on the field, on the court, whatever it may be. And so I think there is that correlation when we're doing things, and then they're also bonding in there, so they're feeling more like a team if they're with their team, and they're doing things together. I do feel like that translates out and say so when they feel like they're getting progress and they're getting stronger, I feel like in general. Maybe it doesn't affect their skating at the moment or that they can't see, but they kind of feel stronger out there. They feel like they can last longer. So I do feel like there is certainly a correlation, and that does come in with the buy-in and the mindset. Absolutely, for sure.
Yeah, it goes back to the people don't care how much you know until they know how much you care. When the kids realize that you care about them, things start to change. I really, really believe that. And it's interesting. So we went to an event last night. So we went to the Kivett Theater music event last night, and it was one of the sponsors. It was the Bork Family Foundation put it on, which was why we went. But the other sponsor was something called Silver Lining Mentoring, and Silver Lining Mentoring sets up pairs up mentors with kids that are in foster care. And one of the things that they said, the reason they do this mentoring thing is they said the biggest component of success of a kid in foster care is a relationship with a caring adult. And so when you start thinking, you translate that over into strength and conditioning. What is your biggest contributor to success probably going to be in that situation? It's probably going to be a relationship with a caring adult. If you're in there and you think, Mike's my strength coach, and Mike really cares about me. He really wants me to do well. He's invested in me as a person. That makes a really, really big difference versus Mike takes attendance, doesn't know my name, doesn't give a shit, puts the workout on the board and barks at me to do it. Those are very, very different things. And I've seen that across the spectrum from Olympians to pros to middle school kids. And it's always the same. When you can create some bond, things get better.
Totally agree. Uh, Same experience with that, and I think it's one of the most important. It's funny that you just mentioned that quote because it is the quote I use all the time. Nobody cares how much you know until you know how much they care. I got that first heard that from you. I'm going to give you credit for that, just like I first heard the big rocks analogy from you. Like I first heard functional strength coach one. Coach, thanks for doing this. Appreciate you, and we'll talk to you next time.
And it's always a pleasure. It's a beautiful day here in Newbury, Massachusetts. Look at that sky outside, huh?
What's up, guys? This is Allie Gilbert, the Queen of Men's Health, founder of the Silverback Summit, which is happening this November 15th and 16th in Phoenix, Arizona, the ultimate men's health event. Today is part 2 of the 4-part series about the myths and misconceptions surrounding testosterone replacement. And today I am talking to you guys about prostate cancer because that is something that is one of the biggest scary things that happens with thinking about TRT, or whether somebody's had prostate cancer or knows someone who has prostate cancer. The typical treatment for that is chemical castration, which means depriving a man fully of both estrogen and testosterone. And they have found that the use of testosterone is increasing in men with hypogonadal symptoms, meaning guys who have low T. And when it comes to prostate cancer, it was thought that prostate cancer grew in a linear way in response to providing TRT, meaning that testosterone would make the prostate or prostate cancer grow. And the saturation model of prostate cancer growth has been shown that if a man is below 250 nanograms per deciliter, the prostate cancer shall grow upwards to 250, and then anything beyond that, it does not grow any further. So the saturation model shows that, yes, it will grow if a guy is very, very low, but only up to 250, which is still a very low level of testosterone. But there's a lot of studies that have been done and been shown that testosterone treatment and the risk of aggressive prostate cancer in men with low T levels has shown that testosterone can be administered to guys who have prostate cancer, whether it's active or they had it before. And so there's a lot of headlines saying findings, testosterone is a friend, not foe. Preventing and treating low T can improve men's health, even in those with prostate cancer and symptomatic prostate enlargement. Testosterone therapy does not raise the risk of aggressive prostate cancer. as one study suggests, and that was 2016. These studies have been done since 2018, 2016, really showing that it is not the scary thing that it once thought it to be. So obviously, I am not giving medical advice to say if you have prostate cancer or if you've had it to go running to get yourself on testosterone replacement. However, if you've had a physician tell you that going on TRT will cause it, that is false. There are no studies that show that testosterone replacement causes prostate cancer. There are only correlations. So take that with a grain of salt, meaning do your research, find some practitioners that know what they're talking about. Don't go exactly by what the first physician you consult with tells you. This is a topic that we discuss on a panel at the Silverback Summit. Dr. Jordan Grant is one of my top physicians who has dealt with many men in urology who have had prostate cancer or actively have prostate cancer who are on TRT. And that will be at the Silverback Summit this November 15th and 16th in Phoenix, Arizona. Come hang out with Anthony and I. Come learn everything that you wanted to understand surrounding men's health and testosterone replacement and what the true risks are and whether you need to be as worried as the media sometimes make it seem.
Welcome back to Naamly's Maximizing the Member Experience segment, where we delve into the strategies and tactics that elevate your business and helps you foster personalized connections at scale. Over the last 2 months, I've been personally dealing with the curveballs that life throws at you. And as the saying goes, when you get lemons, make lemonade. In that spirit, today we're going to unpack a vital strategy to deal and navigate those unexpected challenges that life throws at you, both in and out of the gym. And as we know, this is bound to happen. So arm yourself with this new acronym. You know I love them. It's called the A.C.E method, where A stands for acknowledge, C for communicate, and E for execute. This is a very simple framework that can guide you back on track during turbulent times. Let's break down each step to see how it can transform challenges into opportunities for growth, or worst case, at least let you tread through those curveballs, as I said. Every gym owner or business leader will at some point face obstacles that test their resilience and adaptability. Gosh, God knows I've been tested over the last 2 months. So let's explore how ACE can be your guide through these storms. First, acknowledge. This is about taking a moment to really assess the situation without bias or judgment or feeling guilt. All tough things, I know, but just breathe, let it settle in, and say it's okay. Now, acknowledging isn't just about identifying the issue. It involves understanding the scope and the impact. Is your gym facing a sudden drop in membership? Has a new competitor affected your business? Or perhaps personal challenges are affecting your professional performance. Acknowledge these issues openly with yourself first. Don't be in denial mode. This honest appraisal is crucial as it sets the foundation for effective resolution and prevents minor issues from becoming major ones. Next, communicate. Now, this step is all about transparency and openness. Once you've acknowledged the issue internally and made peace with it, it's vital to communicate it to the relevant parties. If it's a business issue, talk to your teams. They need to be on the same page to help navigate the challenge. If it's a personal issue, which is spilling over into your professional life, consider discussing this with a trusted advisor or professional counselor. Communication also extends to your gym members if the situation affects their service experience, or a select few gym members if you're very close to them. This might mean explaining changes or disruptions, but doing so in a way that reinforces their value to your business and outlines the steps being taken to resolve the situation. Finally, we arrive at execute. This is where planning turns into action. Start by setting clear, realistic goals for overcoming the challenges and be open to revisiting those goals as well. It's okay. If you've acknowledged a drop in membership, for example, your execution might involve ramping up marketing efforts, refreshing your class offerings, or enhancing member engagement strategies. Execution means prioritizing tasks, delegating responsibilities, and setting timeframes, and then holding everybody accountable. It's also crucial to monitor the effectiveness of your actions. This isn't just about doing, it's about adjusting and optimizing to ensure your strategies are yielding the desired results. The ACE method isn't just about managing crisis, it's a proactive tool as well for continuous improvement. By consistently applying these steps, you not only mitigate current issues, but also enhance your preparedness for future challenges. This approach ensures you are not just reacting to the world around you, but actively shaping it to fit your vision and goals. Thank you for joining today's episode. Remember, the ACE framework is here to guide you through any storm, ensuring that you're prepared, responsive, and ultimately resilient in the face of challenges. Keep this strategy in your back pocket, and you'll be equipped to handle anything that comes your way. Join us next time on Enhancing the Member Experience platform as we continue to explore strategies that empower gym owners and enhance every aspect of the fitness journey. Until then, stay strong, stay motivated, and remember to ace your way through life's challenges.
All right, guys, now it's time for the Hit the Gym with the Strength Coach segment, and we have an interesting one today. I just said this to my guest, is that if I'm not a little scared going into an interview, then I know I prepared too much. But for this is going to go in a few different directions. We have on Amber Kivett. She's a licensed certified athletic trainer, functional movement system specialist, certified trainer. She's certified strength and conditioning specialist. She's basically over 20 specialties like orthopedic technology, Eastern medicine modalities, speed and agility coaching, BFR training. So there's so many things that are wrapped up into her background that I absolutely love so much. So she has a unique approach. It's basically a fusion of sports medicine, human performance, massage and bodywork principles, life coaching. So all of that. And as we get into this conversation, you'll understand why the life coaching needs to be part of it, and this idea about the mind, body, and spirit. But Amber's going to tell us her whole story about how she got into it. So, Amber, thanks for doing this.
Thanks for having me today. It's a pleasure.
Yeah, I'm pretty excited to get into this, and then obviously we realized we live a half hour from each other. So I'm going to definitely come by and visit her because this is really interesting stuff. And we got to kind of keep it in check for this audience as well. We can go down, we could be here for 6 hours. I'm telling you guys, when you hear some of the stuff that Amber's gone through with her experience and then an accident that she had. So Amber, I don't normally do this. I don't normally go over somebody's background, but I do want to get into yours because I think it relates so much to where you are today. So so let's talk about kind of going to college and your background that way, and then the accident, and then what happened, and let's get it going.
Awesome. You got it. So we'll start with I went to Purdue as a chemistry major for 2 years. And loved chemistry in high school. Couldn't get past calculus. Tried it 4 semesters and just finally threw in the towel. I had found the love of fitness and wellness. I lived right across the street from the recreation center, so had the opportunity to go to the gym on a daily basis. So really connected with fitness and wellness, and didn't know that the world of kinesiology even existed because I was an athlete in my childhood years. But really had never been injured enough to see or understand what an athletic trainer does, a certified athletic trainer. So when I decided I was going to switch majors, I had a mentor that recommended me to switch into something that I enjoyed doing. And when I went back and evaluated my life at that time, really loved the fitness wellness environment. And so ended up in changing my major to kinesiology, going into athletic training, thinking that I was going into strength coaching. Because when you think of athletic training, but you've never seen an athletic trainer, you think, well, I'm going to train athletes, right?
Yeah.
So I show up to Purdue at that time was one of the top sports medicine programs in the nation. The National Athletic Training Association is the only governing body over all certified athletic trainers in the United States. And the national president is the director of sports medicine for Purdue at that time. So there are people who have come from all over the country to be a part of this program because of his reputation. And Drew Brees had just signed on full ride with our new football coach. We had the women's basketball team had made it to the national championships. It was just the greatest time to be at Purdue for athletics combined of any other time in history, really, for all sports combined, and the people and the Hall of Famers who are there to teach. So anyways, I go to this room and there are 86 students in this room who have signed up for athletic training, quote unquote, what I think is strength coaching. And I'm sitting there listening to their presentation, and they say, if you didn't show up to work 9 hours a week for 1 credit hour, carrying water bottles at football practice and getting spit on and washing coolers and doing all this grunt work, then now's the time to walk out. And I thought, okay, confidence level is not so good right now. You don't want to be the only one who walks out of the room looking like an absolute idiot. So you might as well just sit here and suck it up for the hour. And so I sat there and I listened to the presentation about what the expectations were going to be. Of the 86 students that were in the room that day, they were only going to accept 12 students to carry on the next 3 years. So it's not one of those things that you want to major in it and you continue on. It is a selective process, and you have to get accepted into the program based on a wide range of criteria. And they presented the expectations up front and dress code, how we are to present. If we're not in class, we are expected to be present. We're supposed to be studying in our downtime. And if they tell you to do something, you don't argue, you do it, or you get out. Have to have a certain GPA, had to have recommendation letters, had to have, I remember sitting in the room for the interview process the second semester from those of us that were left. And we sat in a room with orthopedic surgeons, the dean of students, the program director, other athletic trainers who are certified, and then other individuals within the board of directors. And you're sitting in the middle of the circle, and every one of them fires you off a question. And you have no idea what they're going to ask you. And the intention is to see how you can handle pressure, because being in an athletic training environment and being in the spotlight, taking care of an athlete who is down with the media and all these coaches and all these people like hovering over you, how can you handle intensity and pressure? And they put us through that. And out of the 86 that started in the room that day in 98, they took 12 of us, 6 females and 6 males, and I got in. And I thought, oh my gosh, I really thought I was in the wrong room at the wrong time. And I will just say that God put me in the right room for the right reasons at the right time. And so I continued the rest of my career through Purdue, ended up in double majoring in exercise science so that I could get the strength coaching background as well as getting the sports medicine background, and graduated and got licensed and certified immediately within a month after graduation, and was off and running and in the professional arena as a certified athletic trainer. I ended up in graduating in 2002, got married in 2004. I was in a variety of different work settings. So I went from working in high school outreach to working occupational medicine at the airport for FedEx, working with their employees, working in corporate wellness fitness for the National Institute of Fitness and Sports. Did a variety of different things because I was used to working 50 to 60 hours a week as an athletic training student, which that's kind of illegal nowadays, to just working 30 hours a week as a high school athletic trainer. And I was bored because I was so used to so much more. So I ended up in working multiple avenues to get an idea of really kind of what I wanted to dabble in, and had the opportunity to work for Ortho Indy as I was a guinea pig for seeing if an athletic trainer could work an accelerated program rate as an orthopedic technologist, which meant I had to work under 86 different surgeons, learning their protocols, doing their casting, splinting, post-operative care, suture removal, wound management, patient education, all that kind of stuff. I was the first person in the state of Indiana, might have been the first person in the country to have sat for that exam in less than a year's time with experience from all these different doctors and actually passed and proved that it was actually capable of happening. Now that is a standard, an orthopedic specialty certification through the National Athletic Training Association, but I was one of the first to do it. I ended up in not enjoying working with the patient population in trauma or in a hospital setting. So I ended up going back to working in the school setting and that as a sports medicine coordinator. Was the medical coordinator for the World Swimming Championships in April 2005. And very, very stressful week that week with working with the Olympic athletes who were choosing the team to go to Beijing for the Summer Olympics. And I was in charge of the entire event, and they gave me very short notice that we were hosting it. Fortunately, I had traveled and worked with Purdue swimming and diving, so I understood how to put on an NCAA level event. And so I ended up in doing all of that under a tremendous amount of stress and pressure, nailed it. And then the next month was covering a baseball game on a Saturday, May 15th, or I'm sorry, May 21st of 2005. May 21st of 2005 was the day. It was a Saturday afternoon for a baseball game. I hadn't had time off in a while. I hadn't had a weekend off in weeks, and found out that it was just a single game instead of a doubleheader. So I had the rest of the afternoon off, and actually had money in the bank to spend. Great. So I was going to go shopping. Just had bought a brand new vehicle a month before, driving to Yukon Denali, and was sitting at a fresh red stoplight and got hit hard from behind and got pushed into the vehicle in front of me. I took a total of 3 impacts, sandwiched between a 1990 Suburban and a new conversion van, full-size conversion van. I took enough impacts that one of them knocked me out or blacked out. And I had just left, still wearing my sports medicine uniform, and ended up in looking up and realizing that I'm pushing a vehicle into the intersection because my foot was on the gas after I realized I'd hit my head. Well, I didn't realize I'd hit my head on the glass. That was later determined about 6 months later. But I'd called my husband at the time and let him know that I was in the accident. He asked me if I was okay. He asked how the vehicle was. I hadn't even gotten out of the vehicle yet. And it was when I opened the door and got out of the vehicle and walked around to the front that I realized I had spinal injuries and knew something was really wrong. And a sheriff happened to witness the accident, came over and asked me if I was okay. And I said, no, I need an ambulance. I have a spinal injury and I'm not moving. And so they transported me, and I received I'm going to call it a misdiagnosis because they didn't do enough testing to really diagnose me properly. But I was diagnosed at that time with a severe spinal strain, and they gave me, and whiplash, they gave me Darvocet and Tylenol 3 and sent me home. And that was on a Saturday. I was back in the emergency room on Monday, excruciating pain. Started physical therapy or attempted physical therapy on that Monday. Because I was part of the physical therapy department. So I contacted our medical director, had contacted my favorite PT. I said, I need a game ready and I need to start therapy immediately because I can't function. We ended up going back to the emergency room on Monday. They did a total body CT scan and I had 8 spinal injuries. They didn't do anything to check head trauma, but I had the immediate onset of fibromyalgia, which didn't get diagnosed until 6 months later. Didn't get diagnosed with a head injury until 5 months later when I had no short-term memory, and became a vegetable without a spinal cord injury. So that's the short story.
Wow. I mean, this happens and you're getting misdiagnosed. And now how does this start to change? Like, because like, how do you get out of this? Because now you have no short-term memory. Like you said, you're in a lot of pain. You are a therapist. So now we're thinking, okay, you got a lot of connections. You're
Sure.
already, kind of in the business, right? What's next? What happens next?
Extreme fear sets in because I know that I have these multiple spinal injuries, and I have done when I worked for the physicians as an orthopedic technologist in training. I used to do spine research for one of the top spine surgeons in the state, and so I understood the intensity of having a spinal injury because majority of his spinal candidates are spinal fusion candidates. So I'm 27 years old, newlywed, just fresh out in my career after being in college for 6 years. I just want to get my feet wet and enjoy the experience. And now I know I have a spinal injury, or I have several. I have 8, and I have no idea what this means. Do I get to have kids? Am I going to be paralyzed? Am I going to have surgery? Am I going to feel like this for the rest of my life? So constant fear set in. I did not know that I really didn't have short-term memory until it was probably a month later. And my husband was asking me questions, and I really didn't understand. Like, I didn't have the answers. It was very frustrating. As soon as I found out I had all these spinal injuries, you have to remember back then was a time in which OxyContin and controlled narcotics was on the rise, and physicians were getting a lot of kickbacks and a lot of incentives and trips and opportunities for prescribing, and were pressured to prescribe more than the needed dose because it wasn't supposed to be an addicting drug. At the same time, concussion management, concussion education, CTE was very new, in research. Purdue has kind of been the forefront of concussion research from the time that we've really started all of that. But they still really didn't know. Typically, if you have a concussion, you've made contact with somebody. I didn't make contact with anybody. It was in a vehicle that changed inertia. So how can this person who is sitting in this seat with a seatbelt on end up with a concussion, and she hasn't made contact with anything? So we thought. So there was a lot of uncertainties. But the biggest fear for me was my loss of identity. Like, my school needs me, my job needs me. Who's going to do this? Who's going to do that? I remember waking up thinking that there were things that had to be done for these kids at school. Who else is going to be able to step up and do this? And I think one of the rudest awakenings that I had was that the world did not revolve around Amber, and the world was going to continue on without her, and that I was not an invaluable person. I thought, I had bled for that organization. I had bled for those kids. I had put a lot of my self-sacrificing in order to take care of everybody else, and lost track of taking care of myself, and stretching myself really far, which created high levels of inflammation in my system that I couldn't recover. So when the accident happened, now I'm in a real I'm in a lot of trouble because I can't heal. And I had already set the environment in my body for that to happen and had no idea, because nobody understood inflammation. Autoimmune disease was not talked about. Fibromyalgia was a trash can diagnosis. You have this list of symptoms, you fall into this diagnosis. So I was a guinea pig for a lot of doctors. I was a freak of nature. They had no idea how somebody so healthy, a competitive triathlete who is living in the world of sports medicine, can go from this to a vegetable with a completely different personality. And so they started prescribing me a lot of different things as a clinical test, because back then, gabapentin was evolving, and I was a clinical test trial for what was called Neurontin. Neurontin is an anti-seizure drug, which was being used off-label for nerve pain, which is now being prescribed daily for nerve pain. And most people don't understand, but the side effects of gabapentin is early onset of dementia and short-term memory. So I was dealing with it. I was also a clinical trial for the head issues. I had gone through hormonal menopause at the age of 27. I had the hormone levels of a 90-year-old woman because of the head injury, but we didn't understand that it was the head injury that was causing it. So I had to go see a couple of different specialists that enrolled me into a study with University of California for concussion management. And we were doing monthly testing on growth hormone, testosterone, all the sex hormones, thyroid, in order to figure out what we had to do to rebalance me out, because pharmaceuticals kind of put a wrench in all that and can upregulate the wrong hormone release. And I was an absolute mess, and nobody had any answers because nobody knew anything. So I was just a constant experiment with no answers, no hope. And at the same time, I'm trying to be a wife to a new marriage, and I can't move. I had to learn how to walk functionally again on an underwater treadmill. And with the onset of fibromyalgia, you have severe pain. You feel like if somebody happens to touch any part of your body, you feel like you're being stung by a swarm of hornets or bees. Like, you just feel this constant pain if people touch you. And if you don't see it coming, it can make you feel absolutely miserable. And at the same time, because I had this head injury that nobody could diagnose for 6 months, you can't listen to music, you can't watch TV, you can't be in sunlight, you can't read, like, you can't do anything. So yeah. I remember, 27 pills a day. is what I was taking through prescription from 7 different doctors. And back then you didn't have the controlled substance log. So 8 to 10 of those were Percocet, 4 to 6 of those were Tramadol, taking Flexeril in addition to that, Lyrica, gabapentin, or Neurontin at the time. Cymbalta was being tested as an antidepressant for people who are suffering of pain, which does not affect sexual excitement or libido. And I gained 50 pounds in 6 months because of all the medicine and all the steroids. I was on steroids. I'd gone through 3 spinal epidural injections because I was not a surgical candidate. Thankfully, I had the right surgeon who refused me treatment. But I remember, well, I don't remember. I have been told I was hallucinating at home one day. And when he asked me who I was talking to in the room, and I didn't know I was talking to people that didn't exist, we realized that I was being over medicated. And at that point, I remember knowing that I didn't want to live that way. I didn't want to live without my mind. And so at that point, I was ready to cut cold turkey on everything, which you cannot do. But I tried. I decided I'm not going to take anything else. I'm just going to use the game ready, and I'm just going to go to therapy, and I'm just going to, whatever happens, happens. You can't do that. Not good for the brain. I had severe migraines every day from the head injury. And so I fired everybody and said, I'm done. I'm tired of being a guinea pig. I hired an Asian doctor to do acupuncture on me because I just wanted the headache to go away so I could try and move. And so he ended up in doing a form of cupping called wet cupping, which is excruciating if you have fibromyalgia and you're in tremendous pain and you're full of toxic energy, toxic stagnant blood. And I remember him doing that, and I felt like I was burning alive. And I cried for those treatments for about 12 weeks. And I can get into that treatment here in a little while. But I went through some very experimental treatment that we had to pay for out of pocket because insurance didn't cover any of that since it's experimental. And I hired a massage therapist to work on me 2 hours a week because I understood massage and how to connect with a massage therapist with working with swimming and diving and learning from working with elite athletes at Purdue. So I understood the world of body work. And then I hired a chiropractor who I'd never experienced before in my life, but she did a lot of manual therapy as well. So hired the right person to help me there. And I hired a psychologist to help me work through the mind, to help me figure out how to live with this new identity of, in my mind, being a loser who isn't going to go anywhere because I am worth nothing being a vegetable. And my husband is not going to want to stay with this. I'm not good enough for him anymore. I'm not good enough to be with my friends. I'm not going to be good enough to work on this career that I just worked 6 years of my life to learn from. It was a very, very heightened time of fear and anxiety. Anxiety is just simply the fear of the future, the fear of the unknown. And I was full of it. So, I hired a psychologist to help me manage my new identity and to how to learn how to interact with people in public when they would see me. And I looked so different from the last time they had seen me, because when you have 8 spinal injuries and you don't have much memory, you don't go anywhere. You stay at home. And then when people do see you, you are either on a scooter or you're moving very, very slowly, or you have somebody escorting you. And that was my life for about a year. And so I had to learn how to manage people's expressions, their comments towards me, because I had one high school kid that walked up to me and asked me when the baby was due, and I wasn't pregnant. Oh. So it was crushing. And I'm swollen. And every physician visit, every PT appointment you go to, everybody wants to know your pain number because that's how they prescribe more pills. And I didn't want to talk about pain anymore. I just wanted to be me, but pain became my identity. So I had to learn how to figure out life away from that. And then every time you come up in contact with people at a gathering, at a wedding, or wherever, people, well, how are you doing? Well, are you doing okay? Are you still in pain? What's next? Are you going to get to do this? And the questions that they were asking me, I didn't have answers to, because that's the future. I have no idea what's coming, and it made me feel very uneasy. So I just didn't want to be around people, which is not my normal personality. So that's kind of what happened. That's what I became.
Yeah, it's interesting too. I think number one, I talked to you about this a little earlier when we were offline, is I'm so glad that you went through all that training, the athletic trainer first, right? Because you made a right turn. You had a tipping point. You made that right turn and said, no, you're all fired. I'm going to go and try something different. Whereas a lot of people would probably not make any turn. They would just stay straight on that course, keep taking the pills, keep gaining the weight, just keep getting the doctors I know had told you not to do any movement. So now you're not
Correct.
doing anything. You're in pain anyway when you're doing all these movements. So number one, that I think that piece of it gave you the open mind to say, no, there's an alternative. I got to find something. I got to keep going. I got to keep pushing. I can figure something out. That was just your brain, in my opinion, like that you were inquisitive. You wanted to figure this out. You knew you can get better. Cause that's what I feel like. That's what I do whenever I have a problem. Like I played hockey the other 2 weeks ago and I haven't played in a long time. So it's like my first month back and I kind of got a little mini groin pull towards the end and I got off the ice right away. I didn't like try to stretch it or whatever. And I've been working from a strength training perspective and some isometrics and working whatever. So I'm slowly, I feel like, hey, I can get this better. It's better now. I was skating later today. So, but that's my mindset is that I don't really rely on something else to, to fix me. I try to, I use, don't get me wrong, I use plenty of other people to help me, but I'm just saying, like, I've had that mindset where I'm like, this can be fixed.
Sure.
And I think it's also awesome that, you know, you're going through all of this and you understand what the client's perspective is. You now have more empathy for somebody who's in pain. Cause I think a lot of times, I, admittedly, I will do this. Somebody will come in and well, this hurts, and let's say I've been training them for 6 months, and this shoulder hurts, and kind of in my head, I'm rolling my eyes a little bit. I'm like, oh, come on, like it's always something, right? So I think
Right.
more empathy to say, hey, look, and I do as well, but not from your perspective. So I think those are two things that were really important in this whole process.
Sure, absolutely. And I think that gives me a huge edge because when I have what I do now professionally is I specialize in non-medicinal pain relief and it's instant relief. Um, I would have paid anything to have an Amber when I needed her. So when I have clients that fly in or clients who call me at 10 o'clock at night and they're desperate for an appointment tomorrow, or they call the day of and I have to give up my personal time in order to be able to help them. My ex-husband said all the time, you're the only person that I know who loves to work. There's something wrong with you. And I said, no, I understand how these people feel in some capacity. And if I can give them relief, then we have a chance. You know, um, Physical pain will make you go mentally insane because it's especially nerve pain. If you have nerve pain, it is the worst imaginable pain. You can't describe it. I've had a baby, I've lost a child, I've been through rape, I've been through all types of other injuries. There is nothing worse than nerve pain. It's unexplainable. And nerve pain doesn't subside, it doesn't come and go. You feel it a lot all the time, and it can be very motion specific, or you can feel it. If you have neuropathy, you don't feel anything, which is even worse. Like if you can't feel where you're putting your foot down when you take a step, your neurosensory is not there. Your brain can't make a decision of what to do next. So it creates fear. So I see so many people who come in or people who call and they share their stories. And, most medical professionals don't care about the story. They might listen to 2 or 3 sentences of their history, trying to look for clues. But you go into an algorithm flowchart in a computer system and you put the symptoms in and they ask you the questions, yes or no. And then they want to know specifics. And then it spits out a diagnostic list. And then based off of that, you get a prescription or you get a referral or you get a list of suggestions. But what most people don't understand is physical pain. It is what it is. If there is a mechanical, biological, musculoskeletal problem underlying, but all physical pain manifests from something far deeper on an emotional or spiritual or mental level. If you have emotional pain, emotional pain, spiritual pain, or mental pain, and those are 3 different categories there's 4 major categories of pain, but those are the 3 that we don't necessarily feel on the outside with our nervous system, but they influence everything we feel physically. So most people who come in who have a lot of check yes boxes on multiple areas of pain. I have neck pain, I've got back pain, I've got hip pain, or I've got heel pain, I've got hip pain, I got knee pain. Yes, there are those diagnostics that have been proven objectively from a physician to the point that insurance will pay for you to go to physical therapy and get the x-rays and all the other stuff. But there's something else much deeper going on that most medical professions in the Western world and the United States have no idea is there, because it is science that has been exposed in the Eastern world, and it's through the fascial connective tissue system. And fascia is what I've been learning about fascia since the late 90s. And I have learned how to restructure and hack into the fascia. And the fascia is what dictates everything in the human body, including how the brain functions and releases hormones. So I got to learn a lot about that. Fascia carries pain thresholds 10 times greater than the nervous system does. So you can have a nervous related injury or a musculoskeletal injury, and the fascia magnifies that physical pain because the fascia is what is holding it. And if you can figure out how to pamper that energy or that whole system, then you can relieve a lot of pain systemically on all levels, not just physical pain, but you can let go of the trauma that has been hibernating within those tissues, because trauma does hide. Most people that come in, I tell them, I know that you're telling me what you want me to do for you. Like, I know you're telling me where your pain is, but I'm going to invite you to open your mind to hope and to belief that I can help you, because where you have been treated is not where the problem is lying. It's where they think it is, but it's lying somewhere else. The area that you're having pain is the compensatory area. That's where the body is running out of energy and is overcompensating to keep you going in a state of fight or flight. The body's not meant to handle that kind of intensity. So, but we have to figure out where the underlying source is, release that, restructure that, and then everything else gets better. Most Western medicine professionals don't do any of that, nor do most understand it. And I lived it because that's how I got better, was doing everything I was told not to do.
Yeah.
And then continued to research it as a scientist, as a coach, as a clinician. I don't like to call myself a therapist, because a therapist, you go to school, you get certified, you get licensed, and now you're off and running following the protocols. But a therapist doesn't connect mentally, emotionally with their patients. So, and they don't get to follow them after the fact. So I like to call myself a coach, because a coach gets the opportunity to change their life forever. And I get to stay connected as an influencer for those individuals as they want it. So I just happen to be able to fuse all those worlds together full circle through my scope of practice, in sports medicine, in human performance, in the extra specializations of body work, and through now what we consider life coaching, which is basically sports psychology for the general public. But there's not enough sports psychologists around to fill the void. So now we have this opportunity to help if you understand how to go about the approach, because it's not a cookie cutter approach.
Yeah. Amber, before we get into, I really want to get into the fascia piece of this, because, like I said, the fact you did the lecture and practical at Perform Better in Chicago this year, and that's the same audience that we're speaking to. So I want the listeners to be able to at least get an understanding of where some of this stuff is coming from. But how much do I need to believe in you or what you're saying? So let's say I come to you, I'm like, Amber, I have, this is my problem, and you go through this, and I'm still skeptical. Do you have I know people are coming to you last minute, and they're usually like, hey, I'll just whatever, do your thing.
Mm-hmm.
But is that piece really important? Like, let's call it buy-in or the belief.
Yes, yes. I'll talk about that. So, and I've had to learn a lot about this. I do a lot of spokesmodel work for Life Pro, which is a recovery tools manufacturing company, and I have had to learn so much about the science between the brain, red light therapy, infrared light therapy, whole body vibration, all these different ways of hacking into the entire human body. We have more electrical connections, which we call synapses. We have more electrical connections in one human brain than all stars in the Milky Way galaxy combined. And we have more complexity in one human brain than all computers on planet Earth. So doctors, it's impossible for them to know it all, because every human brain is different. Yes, we all have the same list of assembly parts, but I'm telling you, I've worked on thousands of people. I've never seen two humans with 2 feet that are the same on the same human, And I've never seen two humans that are built anywhere comparable to each other, because our body changes its connective tissue system and its electrical firing patterns and the chemistry based on our experience and our stress and our recovery. So yes, belief is very, very powerful, because we think anywhere from a proven fact, 60,000 to 70,000 thoughts per day is what we process. We don't realize that we're processing that much information, but that's what we're processing. Over 40,000 of those thoughts for a lot of people are negative. For most people are negative. And the way that we think is what changes the hormone levels in our system when it comes to the brain waves and the chemical balance in the brain. If we are constantly feeling fear, anxiety is fear of the future, fear of the unknown, which is a huge buzzword right now. We didn't hear about anxiety 10, 20 years ago. We heard about depression, and we heard about bipolar, and we heard about all these other mental disorders, but you didn't hear about anxiety. Most people didn't understand it. But because the way the modern world is, with all the blue light, with all the stimulants around us, with all the pharmaceuticals, we're in a constant state, our lifestyle, professionalizing of youth sports, the intensity of making it to college, the intensity of making it in general, our identity. We are constantly go, 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 go. The human body was not created to go, 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 go all the time in a state of fight or flight. The fight or flight system is all about being chased. We're being chased by a lion, and we are trying to save ourselves from the lion that's trying to eat us. That's our animalian instinct of survival. Our autonomic nervous system is built of our sympathetic and parasympathetic state of the nervous system. And what that means, and this is really important for coaches to understand because it comes back to human performance training. The sympathetic nervous system is about our central nervous system. So our heart rate, our respiration rate, the vagus nerve, adrenaline going to the limbs, and blood flow going to the limbs, and our body being able to keep up going. So adrenal glands attaching to the back of the kidneys is the hormone that is released to keep us going strong, to where we can be alert, we can be thriving, we're living at our most efficient self, if that makes sense. Our parasympathetic nervous system is our rest, recovery, digestion. You cannot digest when you're in a state of fight or flight. The body shunts all the fluid, all the blood to the extremities to help us stay going. We're running from the lion. When it comes to the parasympathetic nervous system, that is our sleep, that is our meditational, that is our spirit, that is how our gut regulates itself. That's why they're saying now that there's two brains in the human body. Our gut brain is brain number 2. Our actual brain in our cranium is brain number 1. There is a direct correlation to both of those. When it comes to inflammatory hormones, those are constantly being surged in the fight or flight sympathetic state. So adrenaline, norepinephrine, cortisol. Cortisol is the tipping point of having autoimmune disease and not having autoimmune disease. There are over 80 autoimmune diseases that have been defined in the medical world, including cancer as being one of them. Cancer, diabetes, high blood pressure, fibromyalgia, multiple sclerosis, cystic fibrosis, all these things. In the parasympathetic system is where our dose of happy hormones is released. Dopamine, which is our addiction hormone, oxytocin, which is our love hormone, serotonin, which is another happy hormone in the brain, but 90% of serotonin is manufactured in the gut. And then our endorphins, which are natural painkillers. Those are manufactured and released at an optimal level when we are in a state of recovery, in which the heart rate is more depressed, respiration is more at a lower rate, where we're breathing more through the diaphragm, through the gut. And we can't be in both systems at the same time. There's no dimmer switch. We're either in one or we're in the other. And the gatekeeper to that light switch is the vagus nerve, which is our 10th cranial nerve. And it accesses every single system in the human body. So if you have athletes or clients who spontaneously can pass out, or they go from being go, 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 go to I'm lightheaded, dizzy, I feel like I'm going to get sick, that's the vagus nerve that is operating that system. Most people don't understand how powerful the vagus nerve is, and that it is a great measure of whether we are truly healing or not based off of its symptoms. And it's free. There are a lot of methodologies that are free in enhancing or improving vagal nerve tone. So when it comes to believing, because of all of the synapses that are taking process in the brain, what happens when we have an injury, when we get sick, And when our body has to slow the system down in order to be able to catch up to keep us alive, is it shuts that neurological electrical highway off. So if you're in Indiana, you and I are in Indiana, we have a massive interstate system. We have I-70, we have 74, we have 65, we've got 69, we got 465. We got highways, east-west, we've got West Washington, East Washington, we've got Meridian, we've got all these city highways, and then we have all these rural routes, right? If there's an accident on I-70, we get diverted. They shut the highway down to clean up the mess. We get diverted off the ramp to taking the city highways or the rural highways. Everybody does. Like the semis, all the small vehicles, everybody has to go these other routes. Your text message doesn't come through, or you don't have reception on the radio. That highway, I-70, is back open. So meanwhile, all this traffic is flowing through highways and back roads that are not equipped to handle that kind of information, that kind of traffic. So when you turn the highway back on, now we are traveling most efficient, fastest route to get from point A to point B. And the brain on an electrical level is the exact same way. So it will shut down the path that has been involved in stress, whether it's an injury, whether it is emotional, whether it is an illness, whatever that highway is. Like I said, we have more electrical synapses in one human brain than all stars combined in the Milky Way galaxy. That's over 1 trillion. And when we look at how the human body is put together, electrical highways, the nervous system, the meridian, the 12 parallel meridian highways, all of it combined, if you open up an old school road atlas from like the 1990s, before we ever got GPS coordinates on a smartphone, and you see the entire country and all the different colors of roads and all the connection points of roads, the different types of roads, those that are dotted, those that are green, those that are red. You get what I'm saying? When you look at all of that, the human body is routed exactly the same way. There are so many ways to get from California to New York. But if we can't get on the main highway and take the most efficient route, then we're taking so much more time, more fuel, more wear and tear on the vehicle, engine parts breaking down, going through tires, hotel rooms, more time of trying to figure out how to get and navigate. Our body is trying to do the exact same thing, and it just cannot keep up. And so if you don't believe that something is possible, the brain can send that electrical highway. It can send the signal blocking you from being able to receive the help that you need. And if you can't see it, and if you can't believe in it, your body will not surrender the opportunity for it to happen. So the mental component is number one. If I've got somebody who comes in with a tremendous amount of symptoms, a lot of physical pain, and I'm looking at a lot of trauma, I start with a mental coaching effort in the first 15 minutes and explain to them, like, this is possible, and this is why, and this is why I'm different versus what your doctor, what your other therapists or your other practitioners have taught you. This is what we're going to try. I have a 90% success rate in 1 to 3 appointments for non-surgical cases. Most of those are spinal surgery fusion candidates. We still get to build their mind up for what's happening on the other side of the surgery, so they come out stronger on the other side if I can't fix them in that moment. But if we can't mentally hack into where their mindset is, because they're coming from pain, from doubt, from disorientation, from distortion, they have completely changed who they are as an individual because of a pain pattern and because of an electrical highway changing, because the happy hormones are no longer going off. And in order to get those to go off, you have to take a pill, which then provides all these other side effects, which then creates a whole nother, storm of highways. So it's a downward spiral. So I start with teaching them that we need to have hope, because I've done it so many times in helping other people. I've seen this so many times, and Western medicine will not tell them, I can help you. I guarantee you, I can help you. They will not do that because they're taught not to. I am outside of that world. I'm in my own world. So I guarantee them, we are going to help you in some capacity. And I know I can, but we are going to have to start with the mental side of things first, because I have no chance of helping you physically unless we can mentally pull you out of this hole that you're in, because I'm going to be fighting my own energy, and you're blocking what I can actually do for you. And when they start to feel hope, because I'm telling them that it's possible and I've witnessed it and I can show them the testimonials. I can show them the before and after. When they can believe in it, that's where the magic actually happens before I even touch them. And I've had so many cases in which people have come in that I've put them through the corrective exercises that most strength coaches have access to, that it's within their scope of practice. I've already put them through those correctives, but I've also gotten into their head and teaching them why we need to be thinking about this. And let's look at the gratitude. Let's look at the positive. Let's celebrate the little things that are actually happening. And I'm reminding them of why that's important. Before I've even touched them, their pain has already dropped by 50%. My job has now become way easier. I only have to move the needle 50% for
Yeah.
complete relief, so it's a huge component and most people underestimate it.
Yeah, that's a good takeaway, because really what I am hearing too, and it's kind of right up my alley anyway. It's kind of what I believe in as well. I don't have the credentials or the background you have. And I think that's the encouraging part for some of us that don't, is that there are things that we could do with our people, get them in that mindset, get them to understand that we can help them, to a certain level, obviously. And then, and like you said, do some of the things that we know have worked for some people, but hey, why hasn't this worked in the past? Maybe it was because of that block and that belief. So it's good stuff. So I do want to try to jump into this idea about fascia, because now when you were
Mm-hmm.
talking, I'm just like picturing the fascia being these highways as well, right? And you were talking about pain in the body can be mistaken for unhealthy fascia, and there was
Mm-hmm.
I know, in your talk you did 6 reasons that cause fascia to communicate pain, and then what we can do. And yeah, I like to use the word pamper the systems for optimal performance. So let's go over some of that, like an overview of this lecture, and about the fascia, and what those 6 things are that can kind of communicate pain.
You bet. So the most important thing to remember, anytime that we have an injury, our body will continue to put down granulating tissue and what we call scar tissue. Scar tissue is very randomly positioned like a ginormous patch. There's no right. How do I put this? There's a law in the therapeutic world that states that the body, however the body is in motion, or the stress that we're putting upon our body, the body will lay more and more scar tissue or replacement cells in a very spontaneous random blob. And until we actually manipulate how that blob is taking function, it has very limited electrical highway reception, and it has very limited blood flow, if any. It's just basically a Band-Aid over a cut. And so when it comes to going back through any and every scar that you've ever had in your life, any injury that you've ever had in your life, we have layers and layers of this scar tissue that is very similar to fascia, and our body tends to create compensation based on that, because again, the brain reroutes around it instead of being able to route through it. So fascia, what I want you to think about is fascia is very similar. How I describe it is you take a pair of fishnet pantyhose. And for those of you who are millennials or younger, you might not have any idea what I'm talking about when I say fishnet pantyhose, but look it up. We take 12 different layers of fishnet pantyhose, because there are 12 meridian fascial lines. They're different fascial slings, yes, but there are 12 meridian fascial lines in which we're seeing dominant layers or patterns of fascial connective tissue and how it aligns with the structural part of the body to allow energy to transfer from one area to another. Fascia is the connection and the transfer force of all motion and how the body regulates fluid and how it communicates. It is the sensory system in the human body, and it's the forgotten system, as it's referred to nowadays in the medical world. Because most doctors, when they would look at a cadaver, fascia only shows up when it's hydrated, and there was no technology until recently to being able to see fascia in its live state in a living human body that's hydrated. And it looks totally different. So when they would cut into a cadaver or they would dissect a cadaver, fascia really doesn't show up. It shows up as like a dehydrated web that they've mistaken for as part of the muscle or the tendon, but it's actually what takes over the whole body. but we have 12 meridian slings of fishnet pantyhose dipped in jello is what I like to call it. So if you can imagine fishnet pantyhose dipped in jello, and we have those 12 different layers intersecting, starting at different points, ending at different points, no empty spaces in between, and it's constantly reshaping and reshifting. That's the easiest way to explain what fascia looks like under the influence of somebody who's alive with a camera in the body. It's unbelievably fascinating to see what it looks like. Take a spider web and imagine a spider web that has been spun in so many different planes that we don't have our traditional planes anymore, our traditional 3 planes of motion. It's more omnidirection, which means it's infinite. There are infinite directions of how this connective tissue comes around. And fascia, the fascial connective tissue system, makes up anything that has contractile tissue, which is everything in the human body except for blood and bone. Blood and bone are the only 2 what is considered connective tissues that don't have contractile ability, but blood travels through fascia, and all contractile tissue attaches to bone in some capacity. So it still matters. But when it comes to fascia, fascia connects everything from muscles, tendons, ligaments, nerves, meridians, skin, fat, organs, meninges in the brain, pleural membrane, anything and everything in the human body, except for blood and bone, are connected. Bone is porous and it doesn't give and take. So that's why it's not considered part of the fascial system. But it's still, that's what everything attaches to. So we still include it. So when it comes to imagining this incredible matrix, you're hearing about collagen is a big buzzword right now in the wellness, strength conditioning, human performance arena. It's because fascia is made up of, the way that fascia is chemically compounded, it is made up of collagen, elastin, hyaluronin, and ground substance, which is 80% water. So that's why hydration is super important. That's why as we age, we lose collagen, which allows our skin to sag a little bit more, allows our discs to shrink, allows our spine to become and our bones to become more brittle. But fascia is made up of collagen. So if we can introduce authentic collagen in its purest state, because our body regenerates that, but if we can do that through a healthy source of an organic collagen that converts, we've got 23, if I remember right, 23 different types of collagen in the human body that our body uses that for. That's why collagen is such a big thing right now, is because it is a founding substance of fascia, and fascia dictates everything. When we don't move enough, or we move too much, well, let me rephrase that. When we don't move enough, we have to move every 15 to 20 minutes for the fascia to remain stimulated. And when we don't move in some capacity every 15 to 20 minutes, that jello starts to transition into sticky honey or peanut butter. And then at some point, when we sit for long hours of time or when we're sleeping, it turns into glue. When we eat a lot of stuff made of gluten, gluten is a stimulant for, or it is an enhancer of that ground substance shifting more into the direction of glue. So that's why gluten is a big deal right now for a lot of allergists, nutritionists, physicians to eliminate, because it's an inflammatory food for a lot of people. And it changes the viscosity of the ground substance and the integrity of the fascial connective tissue matrix from being like jello to being more like sticky peanut butter glue. So in a nutshell, a lot of coaches want to break down human performance into joints, upper extremity, lower extremity, hinging, squatting, rotational. But what they don't understand is we can't train the human body on a musculoskeletal level anymore based on insertion, origin, concentric, eccentric, which side is the mover, which side is the stabilizer. We have over 300 muscles. I want to say there's a lot. I don't have that number in front of me because I use that in my cue sheet. I'm going off of straight off of my brain. But I can tell you, between all the bones in the body and all the muscles, we are one moving blob all the time. Like we can't just train muscles, joints, body parts, because that's what creates the restrictions in the connective tissue. That's what causes the connective tissue and the fascia to regenerate more and more and more tissue to stabilize and reinforce those areas. And it causes us problems when we don't move as fluidly, as hydrated as we should. So when we're training, I hear people say, "Oh, I did arms today," or "I did arms and back today." I'm like, no, like fascia is fingertips to toes, and there's no empty spaces in between. We got to move in all of these different positions, all these different directions, and we just have to impose resistance on the human body, because where there's no resistance on the human body, it goes backwards, it disintegrates, and it dies. So you don't have to break down training into joints. You have to make training a total body experience, because we are one moving unit of sensory in fluid, basically. We are an ocean with our bones, and we are constantly transitioning that energy from one area to another in order to be able to survive the lion that's trying to eat us. That's basically how it is. That's the easiest thing to explain. There are 6 things that really piss it off. Drugs and substance, lotions that we put on our skin, what we put in our hair, any kind of a molecule compound that is foreign to what is already regenerated inside the human body is what I'm going to call substance. And that can be pharmaceuticals, that can be food, that can be beverage, that can be alcohol. By the way, it takes 48 hours for one alcoholic beverage to leave the fascial connective tissue system on a molecular level. On a molecular level, the effects of alcohol leave the system very, very fast. So that's why we don't talk about it. But on a molecular level, before it mutates, it takes 48 hours for one alcoholic beverage to leave the human anatomy fascial system before it starts to regenerate itself. It doesn't necessarily leave on a molecular level and on an electrical highway the human brain for almost 8 days, one drink. So those who are dealing with clients who drink regularly and are not getting the results they're seeking, or if you are somebody who enjoys a glass of wine every night, you are destroying your structure electrically and on a fascial level for days at a time. I'm not telling you not to drink, but I'm just telling you that's the facts. So act accordingly. But when it comes to the 6 things, drugs and substance, number 1. Number 2 is surgery or any kind of an injury. So when you puncture a fascial connective line, if you puncture that matrix, that's when the scar tissue starts to lay its area, and the routes start to shift, and the body has to restructure itself because the tissue is not the same. So surgery, I try and keep people from surgery as much as we can. There are times when we have to have it, but there are times that it absolutely destroys our system. So if I got clients coming in for excruciating pain and we can avoid a spinal fusion surgery, if we can avoid a rotator cuff surgery, if we can change a scope on the knee, because it's not the knee that's the problem, it's the hip flexors and the quadriceps along the front line that are adhered. So the knee gets pulling on the tendons, pulling on changing and creating torque in the joint. And it's not meant to be torqued because it's a hinge joint. There are so many things that play into what causes pain in a fine space. So surgery is one of the worst things you can do to the fascial connective tissue system. And if you do have surgery, you need to stimulate the system somehow as fast as possible after surgery so that you can connect those electrical highways all over again and minimize scar tissue. And mechanical vibration is the number one way to do that. Mechanical vibration. That's why massage guns are popular. That's why the whole body vibration platforms. I work with Life Pro. You've heard of Power Plate. You've heard of Vibes or the Vibe. That is a mechanical stimulant to our fascia and our muscles to reactivate and work like they're supposed to again without us actually having to take action to do it. Number 3 is going to be movement too much in the same direction. So I like to say that is overuse of athletes moving in the same direction. So you got overhead athletes who are playing basketball, softball, volleyball for females, or even for males. They might be playing baseball instead of softball, but the same motion over and over and over again. Body redirects and regenerates more tissue along those highways. We are professionalizing kids in the intensity of youth sports. It is a $1 billion industry. Kids are not, their bodies and their fascia is not mature enough to handle the intensity of the type of training and the mental strain that goes on those individuals to be able to handle what's on the other side. So I am seeing injuries in kids. I'm seeing severe depression in kids that we would normally have seen in professional athletes 20 years ago. We're seeing that in 10, 12-year-olds. I've got individuals who are in their 30s who will come in complaining of degenerative disc pain or degenerative disc disorder, which is basically the discs are shrinking and we've got, pain in between the spaces. But I've got 10 and 12-year-old female gymnasts who have the exact same x-ray and they're having to retire at the age of 13 because they've already destroyed their discs because of the intensity of their training. So too much movement in the same direction all the time, not enough movement at all. So that's why they're saying sitting is the new smoking. So when we don't move every 15 to 20 minutes, that's when the body starts to become more solidified, more adhered. And then we try and move and hoping that those muscles and those movements are available. And that's when the injury hits. Or that's when we bend over and tie our shoes and we end up with a meniscus tear or we end up with a locked out back. That's how it happens. It's not because you weren't strong enough. It's not because you twisted and rotated. Our body is meant to do that. It's because you didn't move enough. And so when we think about sitting, we think about electronics. We think about being a desk jockey. We think about driving. We think about driving to and from work, driving our kids to and from their athletic events or to school or whatever they have going on extracurricular. We think about the position in which we sleep. My friends, those are all the same positions. And we're in those stagnant positions. Most people that I see 16 to 18 hours a day, the same position. They're doing different things and they are moving, but they're in the same plane of motion doing very little. So the body is not metabolizing, it's dying. Like metabolism is slowing down. Fluid is further away from the central part of the body. Lymphatic system is on hold because we're not in a state of restoration. We're in a state of fight or flight. So there are a lot of things that are causing a lot of adhesions, fascial adhesions, physical pain, change in the neurosensory because of too much, not enough movement. So we're sitting in the same position or not moving enough. Couch potatoes. Gaming, video gaming is a big one. Then we've got stress. So emotional, mental, spiritual stress. It changes the firing patterns within the fascial connective tissue system, which changes the hormone release, which changes how the body functions in motion, and it also changes, how our body regulates between the in the autonomic nervous system and the central nervous system. So stress is huge. And then last but not least, hydration. We're all dehydrated. We don't drink enough water. We should be drinking on a low level before human performance or training, half of our weight in ounces. And that's clear fluid. That's not just drinking. That's drinking clear fluid with no other additives. And we don't do that because we are constantly distracted by other things of greater importance. But remember, anything below the neck is 80% water in the ground substance fascial connective tissue system. Anything above the neck, because we're talking the cranium and the brain, it's 90% water. So when the brain becomes dehydrated, when the cranium becomes dehydrated, it changes the electrical patterns and it changes how the brain functions because the brain has to be hydrated to function at a high volume. So hydration is really important.
Great. So let me review that. And so any kind of drugs or any kind of foreign substance that you're saying, that's number one, that which could even be lotions. To talk to people about that. Number one, we can talk to our clients about that. Obviously, it's not something we're going to do in the gym, but that's just stuff that we can talk to them about. Hey, be careful with some of these things that you take. Any surgery, okay, even some past surgeries, we obviously can't do anything about, but whatever we can do to kind of keep them from going under the knife. Mechanical vibration, whether that's a massage gun or, you said the Life Pro or power plate, maybe even, a warm up or as, it would be, I know I do a lot of that with my clients, is like have them on the whole body vibration. And at the end, I always use the gun, do some stretching, do some gun.
So I want to expand on that real quick.
Sure.
The reason why mechanical vibration using a vibration platform is so powerful. Power plate and the Vibe are linear vibration. So it's very uncomfortable for most people. When you're talking about Life Pro, there are other similar platforms like Life Pro. Life Pro has lateral and oscillating, which is more like a teeter-totter effect. But mechanical vibration, if you're standing on a vibration platform, can stimulate up to 90% of your muscle fibers to actively fire spontaneously without a brain signal anywhere from 10 to 50 times per second. So it is a reaction to an action, and mechanical vibration is how they keep weight on astronauts in space where there's no gravitational energy, where they would otherwise die. That is how they keep their bodies alive. So if you have people who are having trouble activating like the VMO, or they're having trouble activating the glutes, or they're really sore and stiff in their hips, or what have you, if you can get them on a vibration platform for 10 minutes before you teach them the warm up or the routine that you want them to use, they have the possibility of actively firing up to 90% of their muscles without providing the cognitive or neurosensory command for that to happen. It has already happened, and you've already delivered the blood flow. We've already got lymphatics in place. So it is a powerful, powerful tool if you don't already have that in your facility. And for people who come in with DOMS after a workout, or they're stiff and they can't move, if you get them on one of those machines, it will release all of the byproducts of lactic acid and all of the toxins in the system that are causing the pain. It will cause them to alleviate that fast so that they can actually enjoy the workout with less pain.
Are you having them do anything specific? I mean, it's just like, hey, do your squats, sit on it. Okay.
Sometimes we'll sit on it. Sometimes I'll have them stand on it. Sometimes I'll have them, if they aren't feeling confident by standing, because it is a moving machine, I'll have them sit on a plyo box, making sure that their hips sit at a higher angle than their knees. You don't want the hips to be at a lower angulation of the knee, or you will cause hip or back pain.
Okay.
There are a lot of YouTube videos. If you go to YouTube to Life Pros, LIFEPRO, if you go to Life Pro, they have an entire YouTube page. I've done over 300 videos of how to use the Life Pro platforms for total knee replacement, for knee pain, for shoulder pain, hip pain, back pain. I've got all kinds of workouts on them. There's back to basics videos as to how the technology works. And I include the fascia talk in it with actual visualizations of what fascia actually looks like, why it matters. And then you can also go to my social media pages and you'll find that stuff too. But yeah, and it doesn't have to be a Life Pro platform, but it's most cost effective if you do.
Okay. Cool. So that was again the drugs or substances, surgery, mechanical vibration, the movement piece, either too much in one direction, which would be an overuse, or not enough movement, obviously.
Yeah. So the key with that for training coaches is keep them out of the sagittal plane, because they are sitting in a sagittal plane all day long. So if I have somebody who has back pain or hip pain, and I know that they're doing Olympic lifts, they're doing power cleans, they're doing squats, they're doing deadlifts, that's all the same plane of motion. So you have to get them more into other planes of motion with multiple angulations. So I'll get them into lunge patterns with transverse. And it's not even trying to stay in the transverse plane or in the frontal plane. It is trying to chop through or getting into as many different angles of movement application as possible. They're no longer training a lot of professional athletes with the intensity of maxing out on Olympic lifts. Yes, it is a measure of power, but that training doesn't necessarily transfer out to the field in movement patterns. So they're training with the surge, they're using the weight of water, they're using the sandbags, because you can't control as easily the three planes of motion. You're in an omniplane, like you're in omnidirection. So if you are a strength coach trying to work with your athletes, your clientele, keep them out of the sagittal plane, or find a different way to introduce squats or cleans after they have already done some of the other movement patterns, or make sure that you're taking them through mobility circuits or their dynamic warm up in which they're getting out of the sagittal plane, because the number one cause of spine injuries, of plantar fasciitis, of rotator cuff back pain, neck pain, all of it's a sagittal plane. They're in the sagittal plane all the time. And the connective tissue, the fascial connective tissue pattern that I work on most every day is the back line, as well as the superficial front line, as well. In the diet, there's a spiral line. Those are the three lines that I see overused all the time, that have over created more and more regeneration of connective tissue, that have caused restrictions that are leading to the injuries. So get them out of the sagittal plane well before you start warming up on the platforms or doing the Olympic lifts or the CrossFit lifts.
Yeah, and I think you mentioned the sandbag. So the ultimate sandbag, Josh Hankins, education on that is really good. Todd
Yep.
Wright stuff is really good. The Viper,
Gary Gray,
Michelle,
Gray Cook. Yeah.
yep,
All
great.
of
Michelle
that.
Dalforth,
TRX is a big one.
yep.
You can do a
Hmm.
lot of the same stuff with TRX. You can do kettlebell work. Like there's so many different ways you can do, but get the barbell off of them, because the one thing I see in so many people who are injured is they're getting hurt on barbell lifts. Get dumbbells in their hands, get kettlebells in their hands, because the barbell does not transition to human performance on the field because they're never pushing a straight bar object when they're going against resistance. The object that they're pushing against is another human who is transitioning through a different plane, and they're trained to compensate and cheat a barbell. You can't
Yeah,
cheat barbells and you can't cheat kettlebells.
yep,
Same way. So
yep.
I really stress that for coaches who are working with high level athletes and in the way of preventing injury and making them more successful in their endeavors in human performance on the field, which is a reflection of their creativity and coaching.
Yeah, and I have to say, with my clientele is mostly older people, and we basically are never sitting down. So we're never on a machine. We're doing a lot of cable work. We throw the med ball around. We do some jumping. It doesn't matter. I have an 84-year-old woman, right, that I worked with yesterday.
Awesome.
Twice a week I work with her, and she's always like, I don't know where you come up with this stuff. It's just the stuff that we all do. But
Yeah,
but even
that's
putting
fun.
her on a ladder and doing some stuff with even like rolling some of the lead tap stuff, rolling the stability ball around in different planes of motion, working some band work, Pete Holman's Golf Forever stuff,
Yeah.
all of this stuff to kind of, Todd Wright stuff, the warm up that I use, the Todd Wright stuff, is really super important in getting them, in different motions, using different hand drivers and leg drivers,
Yep.
super important, not just for the athletes, but the last two I love the last three actually, because it's something that we can affect within the training session as well, or kind of talk to them a lot about, and that's stress. I talk to a lot of people about, look, sometimes you can't get rid of the stress, but you want to manage that stress, and there's other ways you have to start thinking about it, and that's kind of helping people. Super important, obviously, and then the hydration piece is just something that we can focus on first of all within the session, but really kind of keep
Promote it.
hammering that home. Yeah.
Yeah.
So good
I
stuff.
want to make sure that your listeners here, no pain, no gain has been a theme for decades. And then the new theory in what we know in the sports medicine arena, as well as in the Eastern world, as pain modulates through physical conditioning in the stimulated world that we belong. No pain, no gain is insane. No pain is insane. So it's not one of those suck it up, buttercup. Like, you can no longer be that kind of a coach, because if our body is in pain, and there are different types of what pain feels like, you can have achy, you can have throbbing, you can have spasms, you can have sharp shooting pains, you can have electrical bolts. There are a lot of different ways that we feel pain. Pain is very subjective and it's very personal. And we don't have a right to tell somebody that they're sucking because they're in pain. Oh, you don't know what pain is. That's adaptation, or you're just having discomfort. We cannot tell people what pain actually is, because it's subjective and it's very personal, and it's based off of our past experiences, and it's based off of our immediate stress levels. So I encourage coaches to be mindful when it comes to working with their clientele who might exhibit through body language pain. A lot of athletes who are in pain are silently suffering, and they will never tell you because they don't want to be put down. They don't want to let their coach down. They don't want to let their teammates down. But as a coach, it is your responsibility to make sure that you are a gatekeeper for them. You are protecting of them, and questioning them and letting them know, look, it's okay if you're having pain. Let's just find a different way to do it. We don't have to do it this way. Let's find another way to do it. We don't have to put you on the bench. We just have to find another way to get there, because there are so many different ways to train nowadays that we've never had access to.
Yeah.
Methodology. So there is no one way to train a human in motion. And it's a very personal experience. It's a very mental experience. And if an individual is in pain, we have to acknowledge that, and we have to find a way to keep them moving while removing the source of the pain, or removing the greatest influence of pain. So if they have knee pain on their left knee, okay, let's find a way to keep their whole body moving except for the left knee. we can work on single leg balance, single leg squats. We can work on offloading that. And if you can keep them as grounded as possible, because all energy enters the body for free through the ground, whether you're in contact with your hands, through your feet, 80% of the nerve fibers, mechanoreceptors that provide the brain with information about where you're at in space, reaction timing, and center of gravity are only found on the skin, on the bottom of the feet, and on the palms of the hands. So core is technically defined as energy transferring between the fingertips and the toes, because the energy enters the body for free through the ground. If individuals do not understand how to feel for that energy, you are working for $20 bills when the ground is giving you $100 bills for free. That makes no sense. So if you can keep them ground-based, or you can keep them wall-based, and you keep them off the machines where they're not in contact with the ground at all, you're causing more problems in the fascia, in the joints, and through overcompensation by putting them on a machine that's not grounding them. So grounding is really important.
Yeah, more reason not to use those machines. So good stuff.
Yeah.
Like I said, we could do this for about another
I know,
5
right?
hours. So, I've taken a lot of your time. So Amber,
Good.
thank you so much for doing this. I'm glad we were able to connect. For everybody, we had Mitchell Sadowski on a couple episodes ago, and we were connecting in Chicago where Amber was speaking as well. And Mitchell's wife went to go see Amber and just was blown away. And she's coming to see you, I think, soon,
Yeah.
once she's had some knee surgeries. So she's coming for, I think, a week. So Mitchell and I are going to make sure we're going to have to all go out together. But Mitchell was like,
can't wait.
yeah, I'm coming. So good stuff. Thank you so much for doing this. We really appreciate you. Your resilience is such an inspiration. Just love your story. Love what you're doing. So Amber, thanks again for doing this.
Thank you so much for having me. I'm truly humbled to be able to be a part of making the world better, and interacting and collaborating with other coaches, because we can't know it all. We have to continue to learn and to reach out to each other. It's not a territorial war for all of us. We're in it together. And whatever we can do to make the world a better place because we are sharing our gifts and our expertise, that's what I'm all in favor of. So thanks for allowing me to be part of your show.
All right, guys, that's going to do it for episode 388 of the Strength Coach Podcast. The show notes are at strengthcoachpodcast.com. Don't forget, you can try both strengthcoach.com and mbsc.tv out for 7 days for free. Go to those respective websites to get the free trial, strengthcoach.com and mbsc.tv. Well, special thanks to Chris Parier and the folks over at Perform Better. Remember, last day of the big summer sale, 40% off over 100 products. Don't forget PB is partnered with Josh Henkin for the Fascial Fitness 6-week online masterclass. That starts, I think, on the 8th. You'll get a discount through Perform Better. Check it all out at performbetter.com. Thanks to Coach Boyle and Amber Kivett for sharing their insights and philosophies into the world of strength and conditioning, performance enhancement, pain, and fascia. Thanks to Sumit, Seth, and Naamly, helping build relationships through personalized communication so your members stay longer and pay longer. Check the show notes out for Naamly's free fitness business boost bundle. 3 gifts to you: a checklist, a cheat sheet, and a guide. The guide is 9 secrets to increase your retention. The cheat sheet is 12 places to look to hire star trainers. And the checklist is 51 ways to acquire clients without running ads. Don't forget, you guys, I will be at the Silverback Summit November 15th and 16th. Thanks to Allie Gilbert. She's doing this 4-part series for us, kind of leading up to the summit. You can use the code AllieG200, get $200 off the Silverback Summit this year, November 15th and 16th in Phoenix. Go to silverbacksummit.com. That's going to do it for this episode. My name's Anthony Renna. Thanks again, and I will speak to you next time.